I'm Mark Quinlan. I'm a second-year medical student at UCL, and I'm going to talk a bit about why I think Andrew Lansley's healthcare bill should be stopped. So firstly, what it's going to do is it's going to open up the NHS to privatisation, as the GP consortia will be able to purchase healthcare from any willing provider, which will necessarily include private companies. Why I think this is bad is because, firstly, private companies will be making money out of public services, so kind of the NHS money will be cycled out of the NHS and to private shareholders, which means less money for the NHS. What private companies are likely to do is provide services that are kind of cheap and easy to make a lot of money off. Things like hip operations or hernia operations, where you can kind of get people in, do the operation and get them out. Easy to make money off, but what that means for patient care is much less integration. There's going to be lots and lots of small services providing these, and much less communication between services. And it's been shown that poor communication between doctors and different services leads to more mistakes, which leads to higher mortality and just general poor patient outcomes. Because the NHS is going to be left with a more complicated, more expensive services to provide. Things like end-of-life care, which have no kind of profitable outcome, but they are very expensive to provide, or things like cancer, for example, are all very difficult to provide, and you can't make any money out of them, so that's what the NHS is going to be left with. The other big problem is that the GP consortia, the BMA have voted against the bill, and GPs generally don't seem to want to do this. They don't want to be administrative staff, they want to be doctors, they want to be dealing with patients. And this administration just takes them away from that, takes them away from dealing with patients and just filling out forms and deciding where money goes. And we have PCTs that do that fine now and provide a whole lot of other services, which, when they are abolished, it's not been clearly set out who's going to provide them. Things like child protection, who's going to do that? We don't know. My other big issue is the cuts. There are cuts to NHS services all over the country. When the Conservatives were voted in, well, when the Conservatives kind of got into power, not that they actually were voted in, we were told that the NHS would be protected, that was the one thing that was going to be kept safe, and yet we're seeing cuts to places all over, like to clinical staff all over the country. There are midwives and nurses being fired, and doctors. We know that we have a midwife shortage. There aren't enough midwives, there aren't enough nurses, and yet there are some being fired. And for the first time, it's looking like doctors, or student doctors who've just come out of a 6-year or 5-year degree, aren't going to be able to get a job. And when you've got that amount of debt on your back after spending that amount of time studying, and you've worked that hard, to then not be able to get a job is a huge deal. And there are cuts not just to kind of staff, but also to services, like the cancer ward at Barts is being closed. And all of this stuff is just going to really negatively affect patients and doctors and society as a whole. I don't want that to happen.